Can I pick up as well on that obesity point? Because when one thinks of well-being, clearly one thinks of mental well-being as well. But just that general point of, hey, do you know what? Your patients could look after themselves a wee bit more, take the pressure off you and leave you freer to deal with those who, frankly, can't look after themselves because of things like cancer. Are the government wrong to say ease off on obesity?
I think it's completely ridiculous, if I'm honest. I mean, obesity is now the #1 cause of most diseases, including cancers, and it is something that is needs more attention, and it certainly needs attention from your general practitioner, who can help you and advise you at a very early stage. For instance, child obesity, because as you know, most of us will probably never see a specialist in their lives. It is your general practitioner, it's a GP-led service, and certainly the GP is your first point of contact. So it is very important that this is something that we do address at all times, and your GP is the best person to address this.
Do you also agree, and it was something that Stephen Dorrell said earlier on in the programme and Richard has just said as well, that staffing is at the pounding heart of all of this, whether it's a practice nurse or an ambulance driver, but much more importantly at the real heart of the NHS, always doctors, be they hospital or be they GP, that we really do need a radical rethink about how people like you and Richard and others become the doctors that we all admire and cherish. Something needs to be done about that, doesn't it?
Definitely. And I've always been talking about this very crucial point. We talk about retention. We rely on a vast majority of foreign qualified doctors, international medical graduates who come to the UK and want to work here. We train them and then we don't give them visas to work and we threaten to deport them. I mean, that's certainly not going to help retaining our workforce. And when it comes to these comments with regards to increasing our efficiency, let me tell you, general practice is one of the most cost-effective and efficient part of the healthcare system. And let me remind you, when we talk about champions, no champion can be bigger than your healthcare staff and your social care staff, because these are the frontliners who've been putting their lives at risk throughout COVID to save the public. And the narrative is certainly another thing that I'd like to touch upon. It's very damaging, and it's very, very crucial that we identify this fact that the government has time and again blamed the healthcare staff for their own flaws and for their own mismanagement over the past decades. It's time that we tell the public that it's not your healthcare professional who's not trying to help you. They want to help you. They're on your side. We are the public as well. But we need better funding, we need better support. There's serious concern around the deliberate misinformation, mispresentation of general practice. If we look at the way general practice is working at the moment, we're 2,000 GPs short since 2015, and we will be short another 1/3 in the next 10 years, and we're already short 6,000 GPs. I mean, you talk about fast-tracking surgeons, fast-tracking ambulance staff, you talk about fast-tracking nurses. That's not going to solve the issue. I'll give you a very beautiful analogy, and I hope you appreciate it. So we go to a shopping center and we need bread. There's a shortage of bread. And what you're telling the public is, don't worry, we're going to give you more lemons and more cucumbers. The issue is bread. Can we not address the problem? I mean, I just don't understand why nobody has been able to address this issue. How are you making the healthcare system more lucrative for people who are highly qualified? If people are planning to leave the healthcare system, or if we're not retaining them, there's a problem. Why can we not simply address it? Why can we not sit down with the stakeholders on one table, general practitioners, people, social care workers, and ask them what the problems is and address it?